Our nation's poor health isn't just a matter of chronic disease 30 or 40 years down the road. We are a less safe country right now because we are an unhealthy country. The opioid epidemic has been a top priority for the administration, for HHS Secretary Azar, and for my office. Did you know that in America right now, more people are dying every day from opioid overdoses than are dying from breast cancer? People with opioid use disorder are not just our patients. They're our family, they're our friends, and if you're like me, they're your brother. To address this epidemic, my office is focusing on 3 critical areas: prevention through better pain management and safer prescribing, educating the public, and saving lives with naloxone. 4 out of 5 heroin users got started with prescription opioids, theirs or someone else's. And it's important that you hear that, theirs or someone else's, because a lot of you out there say, it's not my patients. Well, do you know where all those pills that you prescribed ended up? Maybe not in the hands of your patients, but maybe in someone else's hands. Maybe they're that gateway to a child becoming a person with substance use disorder. As physicians, we have to help prevent addiction before it starts. I'm also working to educate the public about the severity of the epidemic and to destigmatize addiction. Just last week, I was on the Today Show and NBC Nightly News to announce the administration's launch of a new PSA campaign aimed at 18 to 25-year-olds. 2/3 of those in treatment say they got started with an opioid pill before the age of 25. We partnered with the Ad Council and the Truth Initiative to show how quickly addiction can happen and the unimaginable things people will do to maintain their addiction. We must help the public understand addiction is a chronic disease and not a moral failing. Now, make no mistake about it, my brother made some bad decisions. There are often bad decisions involved. But I've got to ask you, when's the last time you refused to give someone insulin because they ate fast food? When's the last time you refused to do CPR on someone because they had a pack of cigarettes in their pocket when you found them? And as physicians, we must say loudly for all to hear, we will not deny treatment to individuals with the brain disease of addiction. Won't do it. Like all other diseases, addiction must be treated with skill, with compassion, and with urgency. And like other chronic diseases, we have evidence-based treatment that works, and we know recovery is possible, but we have to help the public and policymakers understand that. Finally, I'm focused on putting naloxone in the hands of first responders and community members. In April, I issued the first Surgeon General's advisory in over 10 years, highlighting the use of naloxone as a way to combat opioid overdoses. You've heard the statistics. There's a person dying every 12.5 minutes of an opioid overdose. But here's the shocker. Over half of them, 56%, are dying in a home environment. This means we can't rely on docs. We can't rely on EMS. We can't rely on police to reverse these trends. All Americans need to become first responders. My advisory is well aligned with the AMA's opioid task force recommendations, urging more Americans to carry naloxone. And speaking of that opioid task force, I applaud Dr. Patrice Harris and the opioid task force for its work to reduce and reverse the opioid epidemic. As documented in a recent AMA report, the combined efforts of the opioid task force and other leading national health organizations showed that physicians, all of you, have decreased opioid prescriptions nationwide by 22% in the last 5 years. PDMP registration and use nearly tripled between 2014 and 2016, and treatment capacity is increasing. As of last month, there were more than 50,000 clinicians certified to provide buprenorphine in office for the treatment of opioid use disorder. That's a 42% increase in the past 12 months. And we are making progress. I'm confident we will end this opioid epidemic, but we can only get there by working together. As highlighted in the AMA report, this will take a concerted effort amongst prescribers, pharmacists, drug manufacturers, policymakers, and insurers. I want to close the discussion on opioids by talking for just a minute about stigma. We're in the midst of dual crises of undertreated pain and overprescribed opioids. And stigma is a significant problem both for those living with chronic pain and for those with substance use disorders. And that stigma exists not just among the public, but if we're going to be honest, among our colleagues, and perhaps even among some of you. 11% of adults, over 25 million people in the United States, are living with daily pain. That's more than the number of people in the state of Texas. As a nation, we have to examine our attitudes about patients suffering from chronic pain. As clinicians focused on providing patient-centered care, we have to remember that the vast majority of patients with chronic pain are not drug-seeking. We must take the time to listen to our patients without judgment and learn about how they got to where they are and the challenges that they face as they seek a return to function or at least a way to cope, especially as we're pulling the rug out from under them by decreasing availability of opioids without providing reasonable alternatives. And we must use the same discernment to reduce the stigma for individuals with substance use disorders. We need to change the conversation about what it means to have the disease of addiction. We must help America understand that MAT, harm reduction, and naloxone do not enable continued drug use. What they do is hashtag enable recovery.